We started this research named Invisible Wounds, navigating mental health challenges and support for Ukrainian adolescent boys and young men. And we named it Invisible Wounds because in reality, it is an overlooked topic, and it is a wound itself, and it's hidden from the international community. When we're thinking of mental health support in work contexts, it's hidden in the communities itself. For various reasons, gender norms are playing a role, accessibility is playing a role. It's invisible in the community itself, but it's also invisible for individuals as well. As what we saw in the research is that often young men are not even recognizing the struggles they're facing. What stood out most in data collection was indeed the resilience of adolescent boys and young men, and how they managed to cope and navigate around this gender norms, even around stigma, even around logistical barriers, even around forced displacement. So building resilience and adaptive coping mechanisms despite this context, I think that stood out the most in our data collection. I hope it's ending up to be a call for action in this area. But I hope for adolescent boys and young men, I hope it's a manner to normalize the struggles they're having. And I hope for service providers, it's gonna give them ideas and motivation to build youth-led and gender-sensitive interventions when it comes to mental health in humanitarian contexts. We had this participatory nature, and we had adolescent boys and young men co-creating the research with us and reviewing the research with us. But also part of our research team were Ukrainian nationals in Poland, in Ukraine. We had MHPSS specialists. We realized we're limited. We tried to get as many insights as possible, but it was reviewed, and it had feedback from different perspectives: academia, mental health workers and practitioners, adolescent boys and young men, NGO workers, just to make sure that this is actually helping. It's meant to be utilized, it's meant to be relevant, it's meant to call for action on this topic.